Hi and hello. Happy Friday morning, if it's Friday morning and you're watching this. I'm just coming to you this morning to do another series on our Let's Talk About focus. And for the next 3 or 4 weeks, we're going to be talking about behaviour. So if you have any questions or you have an interest in child and adolescent behaviour, like I do, then be sure to watch, be sure to put some questions in and learn a bit and have some questions answered. I'm just going to make sure that this is going live into my page. I'm just going to check that that is happening. Hopefully it is. Fantastic. It seems to be all working. So I decided to talk about behaviour, not because it's something that I think is the most important thing, but it certainly gets our attention. So I really know that when parents or teachers or educators or anyone who's kind of working with kids and teens has a concern, it's usually kind of phrased in behaviour terms, in terms of what a child is doing or not doing that they're after some help for. So, and of course, for me, I'm always kind of wondering on what's happening underneath the behaviour, because that's kind of where I'm always trying to understand that I know that behaviour comes from somewhere. But we certainly often are describing a person's presentation in behaviour. A lot of our diagnostic manuals describe different, I suppose, mental health difficulties or differences in terms of development in a way that's looking at behaviour, because it's observable and in some ways measurable. Not that things like emotions aren't measurable, but I think in terms of behaviour, it's probably easier to do that. So I wanted to talk this morning a bit about some models of understanding child and adolescent behaviour, but all behaviour, but particularly child and adolescent, because that's the space that I'm working in with parents and educators. And it's often the focus, I suppose, of my my work and my support with families. So I wanted to talk about how we understand causes of different children's behaviour and the different models, the different viewpoints or perspectives that are currently out and are being used, and how this makes such a big difference to how we are going to respond or support young people with behaviour or with whatever might be causing that behaviour. So I wanted to just talk to you about a viewpoint of behaviour that you're probably familiar with, because it's really in the mainstream. It's embedded in our medical kind of systems frequently. It's embedded in our education systems, and it's embedded in a lot of the therapeutic approaches that you might come across, and even in the parenting approaches. There'll be a number of parenting approaches that are certainly embedded in this viewpoint around how we understand behaviour, and then that understanding leads us to how we're going to help and how we're going to support. So this viewpoint of behaviour is kind of considered, again, a behavioural approach, which means we observe behaviour, and I think assumptions have been made about that behaviour, that the behaviour is either reinforced in some way or it's discouraged in some way, and that the behaviour maybe is triggered by observable things, maybe in a person's environment, causing that person to respond. The other part of the assumptions is that the behavior happens because a person is either motivated to get something, whether it's to achieve a goal or an outcome. I suppose a bit like we think about people who go to work. We're motivated because we get paid, so that's the outcome. So same kind of assumptions that are often applied to child and adolescent behaviour. So there's some sort of benefit for them to behave in a certain way, but also whatever happens before the behaviour, that's having an impact as well. So that there's a trigger that they're either trying to maybe avoid, and that is causing the behaviour, or there's something that is motivating them. So there's sort of this idea that there's things that trigger behaviour, and there's things that happen after the behaviour, perhaps that reinforce and keep that behaviour around. Now, we know that behaviour is more complicated and complex than that. So when we were kind of expanding upon understanding human behaviour, understanding that it's more than just about things that motivate us or things that we try to avoid, we then put another layer upon, which is the thinking aspect to humans, which is that part where something happens to us, but then we consider about how we want to respond, so that we're not just reacting necessarily, but that we're having some sort of thinking aspect to it, and we have a choice about whether we respond or whether we avoid, or what we might do. So that kind of model is very, very popular, and frequently you'll hear it used in all kinds of realms, like I said, education realms, parenting realms, and it makes certain assumptions about people's behaviour. It assumes there's capacity to make choices. It assumes that if they're making choices that are causing difficulties for themselves and for other people, because challenging behaviour is often challenging not for the young person only, but for also those people around them, that there must be something that they're continuing to get out of that behaviour. So there's some sort of benefit that we're not maybe initially seeing. So when we look at understanding child and adolescent behaviour through this lens, it puts a lot of responsibility on the individual to be motivated to change necessarily. And so a lot of the attention is either around encouraging them to make good choices, and you would have heard that term a lot. So encouraging kids, teaching kids about what their choices are, and encouraging them to make those good choices. The other aspect and the other way behaviour is trying to be shaped and trying to be changed through this lens is looking at appropriate environmental changes. So perhaps changing the way they're being supported, and so maybe trying to avoid some of those triggers that we may assume or may think that are triggering the young person's behaviour, but also creating lots of motivators as well. So trying to reinforce and motivate them to continue to make those good choices. So that's a very broad brush kind of approach for looking at how we can respond to child and adolescent behaviour, and how I think in lots of ways this is the approach that you'll come across if you're trying to understand children's behaviour. This kind of viewpoint, this lens, is certainly what you're most likely to come up against. Now, the issue, I suppose, with this perspective is, and I think for me, it was more that it didn't explain everything, and particularly with my interest in working with neurodivergent individuals, there were assumptions that I think were being made in terms of saying, well, what's considered a trigger, for people, and kind of going off, they couldn't identify a trigger, then there was something else kind of going on. And for me, part of my journey in terms of a child and adolescent psychologist and understanding and working in this space was really getting to understand autistic and neurodivergent people from the inside out, and really trying to understand what it is like being in a body and in a system that responds to environments and triggers perhaps in a different way than what we were assuming. And I think a lot of the assumptions about triggers and about reinforcers were based on and are based on neurotypical children and adolescents. And that wasn't landing for me in terms of what I understood about the children and the families that I had been talking to. The observable kind of triggers weren't really there, and there was something else going on. So it really made me go, we really need to understand what is happening from inside these young people to really understand what's happening and what's causing some of the behaviours that I think were a bit perplexing to people, not quite understanding why this reinforcement behavioural model wasn't really working, and in fact was probably having the opposite impact. So I suppose this led me to the paradigm shift and the viewpoint that I have discovered with a number of other researchers and child and adolescent psychologists who probably, again, years earlier than my work in the same position, kind of going, this doesn't really explain everything nicely enough, and we're missing more that can inform us. So this viewpoint and this paradigm shift is really starting to acknowledge and look more deeply at the nervous systems of child and adolescents and adults, and how when we ask a different question rather than what's causing this behavior or how can we get rid of this behavior, it's really asking us to say what is happening for this child and adolescent when we see these behaviors. So what is happening for them? What's happening underneath the behavior that might lead to this expression of challenging behavior, or whatever the behavior is that we're kind of talking about. And that then gets us to be asking questions about, when do we see behavior like this, and we begin to kind of understand that when we see what we often deem challenging behaviour, and what I've been calling for a long time in my work is dysregulated behaviour that is not somebody in control, it's not somebody who's motivated to do this behaviour, it's a nervous system that is overloaded and overwhelmed. And so this viewpoint, and it's been I suppose looked at through a lens called polyvagal theory, which kind of helps us to explore, I suppose, the history of our nervous systems and how they have a protective mechanism, and there's certain things that get triggered and we get responded to that are based on keeping ourselves safe, and are based on sort of understanding survival and things like that. So already for me, who works a lot with families who are experiencing anxiety, had been doing lots of work understanding our parasympathetic and sympathetic nervous systems, and getting young people to understand what was happening to their bodies when they were experiencing these behaviors that people were talking about. But I was kind of like, well, the behaviors are just the obvious bit that we're seeing. It's all the anxiety or the overwhelm that's happening underneath that is causing that. And so when we asked the question of, what was happening underneath the behavior, then we got to see a young person's nervous system that was completely overwhelmed, and we needed to support that rather than do encouragement or punishments or rewards up at this top level, trying to change the behavior on the surface, but totally missing what was happening underneath, which was a young person's nervous system that they weren't in control of. They couldn't do control of because their bodies were reacting and just responding and trying to keep themselves safe. Logically, they might have known that the behavior was not appropriate, or going to get them into trouble, or whatever that might be. but internally their bodies were just in survival mode. So this lens of looking underneath the behavior and asking questions of what's happening to someone's nervous system when we see different behaviors helps to inform a totally different approach in terms of what do we do about the behavior. So when we understand things differently, the answers we get are going to be different, and they're going to lead you in an entirely different path. So this viewpoint and this lens and this shift is really talking about understanding our own adaptive responses when we move into a space when we feel unsafe, and what that unsafe and how we interpret feeling unsafe is quite unique for each and every person. And again, that's what I really like about this model. It really is respectful about people's different developmental trajectories in terms of whether there has been trauma experienced, whether there has been different kind of upbringings experienced, and how that impacts on somebody's nervous system, how it can be triggered in a way that might not appear threatening to you or I, but then system. The other part of this paradigm introduces this idea and this theory that there is something called neuroreception, which is the ability for our nervous systems to detect threat under our conscious awareness. And when you think about that ability for our body to detect threat and to be quite sensitive to kind of sussing out what's going on around us, it makes you kind of go, okay, it helps to explain why some kids can't explain why they did what they did, or what is making them feel unsafe, or what is making them feel frightened, or what is making them feel angry, because it's perhaps operating underneath their conscious thinking ability. Not to mention how difficult that can be to explain anyway, even if you've got a bit of an inkling that it's about the teacher was yelling at other kids in the class and that makes you feel really unsafe. There's not lots and lots of kids that can necessarily explain that might trigger them into, you know, a meltdown, or it might cause a panic attack, or things like that. Putting those two things together is not necessarily easy unless we're asking the questions about safety and about what makes them feel safe, what makes them feel unsafe, and things like that. So this viewpoint also looks at those cognitive approaches that I talked about earlier, about how we can make choices about different behaviors and things when they happen to us. So it's not saying that we're just reacting to things all the time, but certainly it helps us to look at the development of that ability to be able to employ thinking kind of strategies. And sometimes what happens is we assume when a child moves sort of from toddlerhood to preschool, those preschool kind of years, because they're walking and talking and they're starting to explain maybe what's happening in their world, or they can tell a story and they can maybe make a friend, that they've got the ability to use cognitive strategies, those thinking skill strategies, and applying them to their emotions and their behavior. Those skills are really just forming then, and they continue to form until adulthood. And then you have kids who are neurodivergent, and those skills are going to be forming maybe at a different rate again. So assumptions about typical development and when skills should be there, or when we have the capacity to do that, and then if they can't, well, what does that mean? They should, we just keep rewarding them, or keep punishing them, or keep trying to motivate them to have a skill that perhaps they don't have that skill yet. So this viewpoint asks us to not say whether they should or shouldn't have that skill, but to say, if we're seeing this kind of behavior, it's indicating that those thinking kind of strategies, which are also called by Mona Delahooke in her work, top-down strategies and top-down approaches. So top is in like the frontal lobes, kind of addressing what's happening in our bodies and our emotions. Those strategies are not being effective yet, or they can't be used just yet. So what is the missing part of it is looking at what information is coming in from the nervous system and how that's being supported. So those strategies are called those bottom-up strategies, and being really respectful of our sensory system and how that pulls all that information together, and how if children and teens don't have a good grasp on some of those top-down strategies, it's the parents and the carers and the educators around these children and teens that help to support their nervous systems to be regulated again, so to support them to feel safe and contained again. And so the viewpoint in terms of who's responsible for this challenging behaviour, it's really more of a shared responsibility as well, which is just so wonderful, I think, in terms of giving parents and giving teachers the opportunity to say, we actually can work on this together. And it's, again, less blaming, I think, in terms of how, usually challenging behaviour kids can be really seen to be kind of like, it's like they're doing it on purpose. And even though we're trying really hard to do all this, they keep doing the same thing again and again. So this viewpoint of understanding nervous systems and how we can support them, it's really looking at relationships as well, because what is the most supportive for emotion regulation skills as they're still developing is co-regulation, that ability between an adult with a calm nervous system responding and attending to a child or teenager whose system might be feeling unsafe. So it's understanding those cues and understanding how we can come in and give them some support to make them feel contained and help them kind of feel okay and feel calm again. And that, of course, creates a bond and a safe sense of relationship. And once people can do that, then they can sort of move on and experience their day and things like that. And it reinforces those connections in terms of feeling dysregulated and feeling kind of unsafe, and then having that experience of being safe and feeling calm again. So those pathways in the brain become stronger and more reinforced as well. So the viewpoint in terms of how we respond to children's behaviour really varies depending upon which kind of lens we're understanding children's behaviour from. So I really encourage, if this is sort of interesting, understanding that there are quite different viewpoints on what causes children's behaviour, and if you're interested in more of understanding this different kind of viewpoint, have a look at the work of Polyvagal theory, Stephen Porges, Delahooke, and a number of other therapists and psychologists that have taken some of these theories and applied them to current child and adolescent psychology and psychiatry. I hope that was interesting. I'm just going to check if there's any questions that have come through at all. That's all good. If you have any questions, please, or if you're watching this on replay, just pop your question in. I'll come back and check it out at another time. If you've got specific questions about kids' behaviour and how this might be understood through this lens, let me know. And for the next 3 or 4 Fridays, I'll be looking at a slightly different perspective in terms of unpacking and understanding children's behaviour a little bit more. So thanks if you've been watching along live with me, and I hope you have a really good rest of the day. I did just want to mention really quickly that if we've got families that are new to understanding their neurodivergent or autistic child or teenager in their life, we have opening for Glimmer, which is a coaching program for parents just to understand and unpack what is happening and where to go and what kind of support might be useful at this early stage of of understanding and learning about what's out there. So if you are that kind of parent and you think that would be useful to be able to talk to other parents who are in the similar situation to you, we have a program that's open at the moment, and it goes for about 4 weeks, and we catch up a couple of times a week to unpack and chat about our experiences and do some education around where to from here. So I'll pop a bit of information in the chat underneath this video. If you're interested to learn a little bit more or have any questions, please just reach out. Okay, well, hope you have a really great rest of your morning, and I will talk to you next Friday morning, if not before. Take care, and I'll talk to you soon. See ya.